Hi, my name is Diana, and in this module we will be talking about how to navigate the healthcare system. This video will cover the first part of this 4-video series that is Module 7. We will be covering a lot throughout Module 7, starting off with how to identify and choose a primary care provider. By the end of this 4-video series, we also want you to be able to understand basic insurance terms and to learn how to prepare for a medical appointment. Towards the end, we will also tackle understanding the importance of early gynecological visits. And finally, we want to make sure you are prepared to communicate with your health care provider about your goals and your own concerns. Let's get started. In the United States, a primary care provider, or as we'll be referring to it, PCP, is the main doctor you go to when you need help with your health. They're the person you see for regular checkups, when you're feeling sick, or if you have any questions about your health. Think of them as your go-to doctor who knows you well and helps you keep healthy. They will ideally help you prevent or get ahead of certain health conditions or illnesses. They can also treat a wide range of things like a cold, a sore throat, or helping you manage things like asthma or diabetes. A specialist is a doctor who knows a lot about one specific part of the body or one type of health problem. For example, if you have trouble with your heart, your primary care provider might send you to see a cardiologist. Or if you have a problem with your skin, you might go to see a dermatologist. These are specialists. Also, for those of us with uteruses, we go to see a gynecologist who is a specialist in reproductive health issues. Let's talk about what a hospital and a clinic are. A hospital is a big building where people go when they are very sick, hurt, or need surgery. Hospitals have doctors, nurses, and special equipment to help people get better. If you need serious care or have an emergency, you might go to a hospital. A clinic, on the other hand, is usually a smaller place where you go for regular checkups, vaccinations, or when you're feeling a little sick. Clinics are good for things like getting your shots, seeing your primary care provider, or getting medicine for a cold. Let's talk about pharmacies. A pharmacy is a store where you can get medicine that your doctor says you need. A pharmacist works there and helps you understand how to take your medicine. You can also buy things like vitamins, bandages, and medicine for common things like headaches. Let's discuss public health services. Public health services are programs that help keep everyone in the community healthy. They make sure things like water and food are safe, give out vaccines to prevent diseases, and teach people about healthy habits, such as washing hands and eating good food. These services help stop people from getting sick and keep the whole community safe. So, how do these places work together? Hospitals and clinics are where you go when you need to see a doctor or get treated for being sick or hurt. Pharmacies give you the medicine you need to get better after seeing the doctor. Public health services help keep everyone healthy by preventing sickness and making sure the community is safe. All these places work together to make sure you and everyone around you can stay healthy and get the care you need when you need it. So, in order to access these healthcare services, the first step is finding a medical provider. Look for doctors who accept your insurance. This means they will work with your insurance company, so you don't have to pay too much out of your own pocket. Check for good reviews. Look online to see what other people say about the doctor. A doctor with good reviews is likely to be someone you can trust. The next step is to make your doctor's appointment. Call the clinic. You can pick up the phone, call the clinic or doctor's office, and ask to make an appointment. You'll need to tell them why you want to see the doctor and pick a day and time that works for you. You may also be able to use an online booking system. Some clinics let you book appointments online. You can go to their website, choose the doctor you want to see, and select a time that's good for you. Getting ready for your appointment. Write down any questions or concerns you have about your health. Make a list of the medicines you already take. Make sure to bring your insurance card to the appointment if you are insured. By following these steps, you can access healthcare services, see the doctor when you need to, and make sure you understand how to use your health insurance to keep costs down. Speaking of health insurance, it is important to understand a few terms when it comes to utilizing your health benefits. We are going to teach you 3 very important insurance terms. Premium. This is the amount of money you pay every month to have insurance, like a subscription. Copayment, or sometimes called copay, this is the small amount of money you pay when you visit the doctor. For example, you might pay $20 when you go for a checkup. Deductible. This is the amount you pay each year before your insurance starts helping with the costs. For example, if your deductible is $500, you pay that much first, then insurance helps with the rest. Did you learn anything new about navigating the healthcare system? Do you have any questions about what we just went over? Make sure to write down anything new you learned in the notes section of this app so that you can later refer to it when we make your health plan. And feel free to reach out to a virtual promotora if you have any questions.